If we can synthesize and summarize information and make it available at the point of care, we'll make better decisions.
What tasks do you think beyond scribing is AI going to be really good at helping doctors with? Like, where are the opportunities for bringing technology and AI in? And in particular, I think about this in the context of what I view as kind of the central problem we have, which is not enough hospitals, not enough doctors, not enough nurses, not enough staff, too many sick people, and it's too expensive. Like, it seems to me technology is the only solution I've been able to think of. I wish there was a different one. But where is it actually going to move the needle and make a difference?
Yeah, I guess I'll give you one kind of short-term tangible, and then we can talk just more generally. The shorter term is, I think, summarization. I think summarizing clinical information, both about individual patients, but also the medical literature and knowledge. I think that is vastly under discussed. I think it's extremely possible to apply even today's tools to either patient records or the medical literature to summarize, synthesize, and contextualize information that's meaningful at the point of care. So I think that is really the next wave of tools we'll see. Kind of phase one has been this proliferation of AI scribes and widespread adoption, and now we're starting to see the signals that, yeah, these seem to help. They certainly don't fix all of our problems. Only about a third of doctors use these tools. The doctors who use them seem to like them a lot. Doesn't really save them that much time, but reduces their cognitive load and their reported burnout. So great. So let's keep investing in these and spreading them, as we discussed earlier, to other aspects of the workflow. But I'm really bullish on using AI to summarize information because, this is from Zach Kohaney, speaks about this axiom. At its core, medicine is an information processing discipline. And I'd go farther. I'd say even not beyond medicine, healthcare is an information processing discipline, right? We're constantly looking to collect the right pieces of information, synthesize it into a coherent, logical story or argument, supplement that with other information we need so we can make ideal decisions. And the fact of the matter is that there's just too much information for us to do that with on a regular basis in a reasonable time frame. The average medical record is more than half the length of Hamlet, which is Shakespeare's longest play. You could read all these analogies that people make to great works of literature. But it's just impossible to go through that information fast enough. The medical literature it depends on the estimate you're looking at. There's one study that states it's doubling every 73 days, which I find a little hard to believe, but a more conservative estimate would be the medical literature doubles on average every 5 years or so. So it's within 5 years of graduating medical school, half of what you've learned is outdated. I mean, so I think we need these tools to help us make sense of all of the available information and process it and package it in ways that we can digest it and then take better action. So I think summarization, I think really is the current focus, the current frontier, both for clinical summarization as well as medical literature summarization. And then longer term, which I alluded to, I think the real holy grail, or one of the holy grails, is how do we make better decisions, right? I mean, that's ultimately what it comes down to, is how do we use these tools to make better decisions? And part of it is maybe if we're less burdened from writing notes, for those doctors who like to use scribes, they have more time to think, right? So that's one stream of possibilities, is for less burdened with kind of mundane, time-consuming tasks that we don't necessarily need to do, maybe we can think more. Another is if we can synthesize and summarize information and make it available at the point of care, we'll make better decisions. Another is using predictive algorithms to try and forecast what may happen, so that we can work with people to better understand the risk and help apply judgment so we can make the best decisions to mitigate those risks. So I think long-term can we make better decisions is ultimately the opportunity here with
Yeah.
AI.